welcome. In a medical emergency, what's the real difference between raw panic and a clear-headed protocol? Honestly, it's about 5 minutes of knowing what to do. Today, we're going to transform that potential panic into a plan, giving you the skills to confidently protect a child when every single second counts. So picture it for a second. A child is suddenly unwell, or they're hurt. Your heart starts pounding. What you do in those first few moments? Well, it's everything. Having a plan isn't just a nice idea. It can literally be the difference between a close call and a tragedy. All right, so here's our game plan for today. This is how we bring order to chaos. We'll start with your first response framework. That's DRABC. Then we'll cover the absolute essentials of CPR, how to handle that terrifying choking emergency, managing severe bleeding and shock, and finally, the fast action needed for anaphylaxis. Let's get right into it. Okay, first things first. Before you do anything else, you need a system, a mental checklist to run through every single time. And that system is DRABC. Think of it as your foundation for every single emergency response. So let's break it down. D is for danger. Is the area safe for you and for the child? R is for response. Gently tap them. Shout their name. Can you get any kind of response? A is for airway. Tilt the head, lift the chin. Make sure their airway is open. And B is for breathing. Look, listen, and feel for normal breathing, but no more than 10 seconds. Now this is where your path splits. You need to immediately call 999, get help on the way, and if one is anywhere nearby, you send someone to grab a defibrillator. Now listen up, because this is probably one of the most critical and misunderstood points in all of first aid. Those strange, sharp, gasping breaths, we call them agonal gasps, they are not normal breathing. It's a sign of cardiac arrest. If you see this, or if you're even a little bit unsure, you absolutely must treat it as if the child is not breathing at all. Don't hesitate. So, you've done your check. The child is unresponsive, and they are not breathing normally. This is the moment. This is when we move straight into CPR. Cardiopulmonary resuscitation. And right away, we have a massive difference from adult CPR. With kids, the problem is very often respiratory. It's about a lack of oxygen. So we start with 5 initial rescue breaths. We've got to get that oxygen into their system before we even think about starting compressions. After those first 5 breaths, you lock into a rhythm. It's 30 chest compressions followed by 2 rescue breaths. 30 and 2. 30 and 2. You are their heart and lungs now. This is the rhythm that keeps everything moving until help can take over. But of course, a baby is not just a tiny child. Your technique has to adapt. For an infant, that's anyone under 1 year old, you're going to use 2 fingers and you'll compress about 4 centimeters deep. For a child over 1, you switch to the heel of 1 hand and you go a little deeper to about 5 centimeters. And what about the speed? The pace is absolutely vital. You're aiming for a rate of 100 to 120 compressions every minute. If you need a mental metronome, just think of the beat to staying alive. It's fast, it's consistent, and it works. Okay, what if you have an AED, a defibrillator? The rules are actually way simpler than you might think. For kids over 8, go ahead and use the adult pads. But here's the key. What if the child is younger and all you have are adult pads? Use them. The absolute bottom line is this. Using an AED, any AED, is always better than not using one at all. Don't second guess it. All right, let's switch gears. We've talked about not breathing, but what about when someone can't breathe because something is stuck? We're talking about choking. This is another one of those emergencies where knowing exactly what to do can change everything. Your first job is to figure out how bad it is. Can the child make any noise at all? Can they cough, even weakly? If the answer is yes, that's mild choking. Air is still getting through. Encourage them to keep coughing. But if they're silent, if they can't make a sound or take a breath, that's severe choking, and you have to act. Now, for an infant, you need to support them face down along your forearm. Then, give up to 5 sharp, firm back blows right between their shoulder blades. If the object still doesn't come out, you flip them over and give up to 5 chest thrusts. And notice what I said, chest thrusts, not abdominal thrusts on a baby. Now, for a child who is over 1 year old, the process starts the same way, up to 5 sharp back blows. But if that doesn't clear the airway, here's the key difference. You switch to up to 5 abdominal thrusts. This is what most people know as the Heimlich maneuver. Moving on, let's talk about major bleeding. You have to understand that uncontrolled bleeding leads directly to a really dangerous condition called shock. So when you see a major bleed, managing that blood loss is priority number 1. The protocol here is simple and direct. Put a clean dressing on the wound and apply firm, direct pressure. Don't let up. Now, what if the blood soaks through that first dressing? Do not take it off. Just put a second one right on top of it and keep that pressure on. While you're controlling that bleed, you've got to be watching for the signs of shock. Is their skin getting pale, cool, or clammy? Is their breathing getting fast and shallow? Are they weak, dizzy, or agitated? These are all giant red flags that the body's systems are starting to fail. The second you suspect shock, your actions are crystal clear. Call 999 immediately. Get the child to lie down flat, and as long as their injuries allow for it, you need to elevate their legs. This simple action helps redirect what blood is left back toward their vital organs. And for our final emergency, let's talk about anaphylaxis. This is a severe, rapid, whole-body allergic reaction. When it comes to anaphylaxis, there is no wait and see. Every single second matters. Fast action is your only move. The signs of anaphylaxis are dramatic. This isn't just a simple rash. We're talking about swelling of the face, the lips, the tongue, severe difficulty breathing or wheezing, a widespread skin reaction like hives, and signs that their circulation is failing, like feeling dizzy or faint. It's a full system crisis. Your response is a clear 3-step protocol. Number 1, help the child use their prescribed adrenaline autoinjector. Number 2, call 999 and make sure you tell them you suspect anaphylaxis. And number 3, position the child correctly, usually flat with their legs raised, unless that makes their breathing worse. You know, all these steps, all these techniques, they bring us right back to where we started. The skills we've just covered are incredibly powerful. But what really saves a life in the moment is your preparation. The thing that lets you turn fear and panic into a clear, decisive protocol. We've just walked through the playbook. The knowledge is officially in your hands now. So the only real question left is this. When that moment arrives, and we hope it never does, will you have the confidence to act? Thank you for joining me.